Welcome to Frontline, a part of the program where we dedicate to frontline workers. So today on Frontline, we put the attention on nurses and midwives at the heart of COVID-19 battle. Last week, we got reports that a number of them have succumbed to the virus. This was due to lack of protective equipment for some of these health caregivers in different parts of the country. Joining me for a conversation on this subject is General Secretary David Tinkwan Chum. Hello, Mr. Chum. Hello, sir.
Good afternoon to you and your viewers.
Good afternoon. Thank you so much for your time. How has it been? I mean, how has your day been?
It's been good so far. Soldiering on.
Okay. Let's talk about the number of people who have succumbed to the coronavirus. It doesn't seem as if the figures are clear enough for us to know how many people have actually tested positive. Is it because it is difficult to collate the figures from across the country?
Thank you for the opportunity. To us, it's not difficult at all. You know, our association span from the national level to the district level. Is one of the most decentralized organizations you can have in Ghana. So it is easy. We have the statistics, you have the numbers. And I don't see it's difficult at all putting it across.
As of now, health workers, especially those in your association who have tested positive.
Yes, I'm able to speak for nurses and midwives only. And we know that about 820 people have been exposed to the virus. And then out of that, 87 people have tested positive. We have lost one, and 422 also tested negative and they've been discharged home. As I indicated, eight have recovered, and then 312 have been quarantined and either in self-isolation or whatever. Some of them are in facilities in various parts of the country.
So you have 820 people, did you say 820 people were exposed? 87 tested positive, one has died, and 422 tested negative.
And they have been discharged home.
Right. But 8 have also recovered, which means out of the 87 that were that tested positive, only 8 have recovered.
Yes, only 8 have recovered for now. Yeah.
Wow. How does that make the association and the other members who have not been infected feel?
Well, this is what we've been talking about all this while. Right from the beginning, we made it clear that the concentration shouldn't be only at the COVID centers. But let me add that so far the 79 people that have been, the 87 people that have been infected, 2 were from the COVID centers, or if you like, the designated treatment centers. Okay. But the rest of them are all from the periphery. And that's why we kept saying that we should provide the necessary logistics for those at the periphery who are more at risk to take care of themselves. And I can tell you that it's not like the nurses are not taking good care of themselves. In fact, the figures could have been more than this, but for the way they are trained and all that. The only thing is that they don't have the logistics at the various peripheries to be able to take good care of themselves. And that is a challenge that we have right now.
How bad is the situation with PPEs? Because it keeps coming up. We talk about it. Authorities say, well, we've sent PPEs out. How bad is the situation even as we speak now?
Is that PPEs are something that must have constant supply. Okay, it's not like most of them are disposable. Okay, and something that gets disposed of after single use, you must have constant supply. Once you don't have constant supply, then obviously you are going to have challenges. And as I indicated, we're having serious challenges. That is why people are getting infected. It's not because nurses cannot take good care of themselves. It's not because midwives cannot take good care of themselves. They know universal precautions on infection prevention. We teach people, all right, on infection prevention. And therefore, nobody can belabor that point and come to that illogical conclusion that they are not taking good care of themselves. It's simply because the logistics are not there and people are being gagged. We have gotten information that nurses and midwives who are given or speaking out about some of these issues are being gagged. And we want to sign a note of caution to any management of any health facility who would dare gag any nurse or any midwife. Because we are not here to see to the demise of nurses and midwives. Nurses are supposed to be safe. Midwives are supposed to be safe to save others. We did not swear an oath to save people at the peril of our lives. That is not the profession that I was trained to be part. So we need to be safe in order to save others. And we are asking government to do whatever it takes to provide our people the necessary logistics that they require to protect themselves. Yes. Again, let me use this platform to also appeal to the Director General to, as a matter of urgency, ask regional directors and hospital directors and medical superintendents to stop nursing mothers and pregnant women from going to work. We cannot afford to see any pregnant nurse or midwife getting infected as far as this virus is concerned. We are not going to renege our responsibility. I keep saying we will take good care of the people of this country, because we go outside this country to take care of people who are not citizens of this country, and therefore we see no reason why we shouldn't take care of our people. But we ought to be protected in order to protect our own.
I mean, I can understand the emotion that you attached to this particular story. I'd like for you to listen to the Director General, Dr. Patrick Umabwaji, on PPEs. Listen.
A case who has, because most of them are asymptomatic, and so once you are exposed, we have protocols on trying to do the quarantine as we do for everybody. If we find a case here, some people will have to be quarantined, we'll have to retest them to see they are exposed. But to address that, we've intensified the training, further training on infection prevention and control across the facility, especially outside the treatment centers where they are more careful. And we implore all to abide by these principles. We have also started training our mortuary workers and other workers who are likely to come close to this thing, just to mitigate this matter. So it's something that is worthy to add, and that's why we appreciated that was a race not only in Ghana, across the country, and that's why a lot of effort is being made to protect our health workers.
What do you say to this?
Well, I think I agree with him, but training is not enough. Okay, I didn't hear him say that they are providing enough PPEs for those at the periphery to protect themselves. If you train people, what does that mean? Are you training us to ward off the infection by not taking care of people or what? Yes, training is good, and I can tell you that nurses and midwives are adequately trained when it comes to infection prevention. And it will not take COVID to train a nurse or a midwife of how to protect himself or herself and the patients that they take good care of. They need to provide logistics for our people to work with. That is what we are talking about. Okay. Training, yes, is important, but that is not enough.
How far is the association willing to go in the push for PPEs? Just how far are you willing to go?
We will collaborate with government. We will continue to dialogue with government, but they need to listen to us, because majority of the health workers that are infected are nurses and midwives. And we did not come here to see to the demise of nurses and midwives. So, as I've told you, there are provisions in the labor law. Section 1191 of the Labor Act states explicitly. But we don't want to get to that level. But looking at the way nurses and midwives are getting exposed and infected, if nothing is done about it, we will get there, where we will ask our people to take such actions that are clothed by the provisions in the labor law.
You mean you ask your members to go on some sort of strike in this pandemic?
We haven't said that. But what I'm saying is that it is stated clearly in the labor law that when there is palpable danger, the employee has every right to absorb himself from danger. That is not to be misconstrued to say that nurses want to go on strike. We haven't gotten there yet. But what I want to state emphatically is that we will not sit down for our people to be infected in this manner, and especially when they are not getting what they need to work with.
I really get it. I mean, this part of the program is really dedicated to people like you, so I really get the emotion. You indicated earlier on when you spoke that some management of health facilities are gagging the health workers there. Care to give us some examples?
Yes, I have ample evidence, but at the moment I'm not prepared to give it out. But it is something that has been ongoing. It is something that has been ongoing, and we think that we want to discourage that, because gone are the day that people could just trample on the rights of nurses and midwives and get away with it. We are not going to allow that to continue. So what we are saying is that those who are doing that must desist from such an act, because leadership will not take kindly to it at all.
Specifically, what is it that is happening in these institutions from where you have your reports? What exactly is happening? If you're not prepared to mention the names of these institutions, that's okay. But give us the examples of the stories you hear.
They don't have access to PPEs. And then when they complain, management have the cause to, speak to them in a manner as if, they think that when you report, then you are tarnishing the reputation or the image of the hospital. Meanwhile, the life of the nurse is more important than the reputation of that hospital.
True.
All right? I have accounts where even a medical doctor was reprimanded simply because he spoke about lack of PPE. I'm not speaking for doctors, I'm speaking for nurses and midwives. And I'm saying that we are not going to take kindly to such a thing. And it was reported in the dailies. I don't know whether you checked it, that a particular hospital was mentioned where a reverend minister also is seeking to, gag nurses and midwives, because to them, you are not supposed to complain. I mean, we are not going to allow those things to brush under the carpet. We are going to protect our people, and the reason why we were elected to office. All right, and we want to make it clear that as much as we want to collaborate with government to fight this infection, we will not sit down for our people to be infected. And because we are not soldiers, it is a soldier who swears an oath to protect the territorial integrity of a country at the expense of his life. We didn't swear any oath to protect the life of people at the expense of our life. We are prepared to fight this infection, but not at the expense of our life. That must be made clear.
I've actually run out of words, quite frankly. How much time do authorities who have to respond to these concerns have, especially referring to the labor law that you quoted earlier?
Well, this is an ongoing process, and that's why we keep saying that we are not out of the woods yet. You see, it baffles me when people think that we are out of the woods. The infection rate keeps on rising. Okay, regions that hitherto did not record any case have started recording cases. So if anybody think that we are out of the woods, I'm sorry to say that we are not there yet as a country, and we need to exercise great circumspection. We are waiting on the president. We don't know whom the president is speaking to. Of course, he has experts that he's talking to. But what we nurses and midwives in this country want to say is that majority of the health workers are nurses and midwives. And majority of those who are being infected are nurses and midwives. And therefore, our input must be sought in coming to any determination. Otherwise, we will advise ourselves.
I'm wrapping up this conversation, but you indicated that there is a specific case that has been reported in the dailies. It hasn't come to my attention. Which institution is this? If it's reported in the dailies, it's already out there anyway.
Well, I shouldn't take me to put it out. I'm not prepared to put it out, as I indicated earlier on. It is not out of cowardice or anything, but I think that those management will sit up and do the needful, because we are not going to take kindly to it at all. No nurse, no midwife can be intimidated in this country. No nurse, no midwife's rights can be trampled upon. We will not allow that to happen in this country.
I gave you the chance to speak to nurses and midwives or people of your association who may be watching you right now. A moment of encouragement.
All right. What the leadership of the Ghana Registered Nurses and Midwives Association are telling nurses and midwives in this country is that they should have confidence in leadership. We are not going to abandon them at all in this trying moment. They should continue to give up their best to take good care of the people of this country, and we will do whatever it is in our power to get whatever they need to be able to do their work in safety.
Thank you very much, sir, this afternoon. General Secretary of the Ghana Registered Nurses and Midwives Association, they're joining us here on the front line. His name is David Tenkwan Chum.